makes it worse is when you deliver from home. Hi everyone, it's our ugly as usual. Guys, today I am here to talk about prematurity. You're all aware of this month being the Prematurity Awareness Month. Today I am here to let us understand somehow more about prematurity. Prematurity is the situation when a baby is born before 37 weeks of gestation. What am I trying to mean? When these babies are born, they are called premature or preemie, meaning that our babies were born before term, what we have called the 37 weeks of gestation. Guys, what causes it? There are many, like you can't identify that specifically this is the cause. But among the many, I want to elaborate some few which are almost very common, like maternal causes. Those ones are for the mother. If you have hypertension, those chronic illnesses, hypertension, diabetes, sickle cell, those diseases, those chronic medical illnesses, our mothers are prone to producing babies who are not yet at term. Then we have this pressure that sets in pregnancy. Around 5 months of pregnancy, you never had pressure, but then pressure comes on. We call it from 20 weeks of gestation. There are the ones that we always call preeclampsia and eclampsia, causing this prematurity. Then we have this other one, infections, sometimes the urinary tract infections, but there are a group of those infections. They are viral infections, and those ones can cross the placenta and can affect the baby, in that the baby will be born before term. We have abnormalities of the uterus. For example, if your uterus is too narrow, your uterus has those abnormalities, it cannot contain the baby. Then we have the cervical incompetence. The mother's uterus cannot close the moment they conceive. It keeps opening and the mother keeps losing pregnancy. So sometimes when she tries, by God's luck, they end up producing premature babies. We have the fetal causes. The fetal causes, those are the ones that concerns the baby. If the baby is too big, so when the baby is too big, the uterus will get filled up and this baby will be born before term. We also have these multiple babies. You have more than one in the uterus. The uterus cannot stretch and hold all of them up to 37 or up to term. Then we have this one of polyhydramnios. That means you have a lot of fluid, you know, that amniotic fluid, the one that we call water. The water is for the baby, it is too much for the uterus to handle. Then we have the anomalies of the baby. If the baby has those congenital anomalies, still they end up coming out a little earlier than term. But we also have those ones that are specifically for the placenta. Remember, it's the one that feeds this baby, it's the one that gives oxygen to the baby. So when those ones occur, we have instances like if this placenta is very insufficient, it cannot actually support the baby. This baby will continue lacking oxygen when it is in the uterus. Then now we have when, for example, the placenta has come below. Remember, it is supposed to implant up in your uterus, but in this case it comes in the lower section. So in that way, the placenta can easily detach and the baby will be born. Then we have those ones who have gotten maybe accidents, maybe trauma, maybe infections, and the mother happens to have what we call placenta abruption. And in that case, the placenta will separate earlier than maturity. So, but there are many ways how we can prevent this. Most of them, they survive once you deliver in the hospital. What makes it worse is when you deliver from home. So this baby is going to receive the medical attention. By the time you bring them to the hospital, our golden 1 minute is already misused. Guys, have the best.